I've got my trusty assistant in front of me. What I want to do is demonstrate a little bit about Tonopen or TonoVet technique. Now, it's interesting because a lot of times I will get a case that gets referred to me for glaucoma in both eyes. Now, the rest of the eye is completely quiet. And I will say this, that in that case, a lot of the times it's technique that goes into that high pressure reading. It is uncommon. I'm not going to say it's impossible. It is uncommon for a dog to develop primary glaucoma in both eyes at the same time. So what you want to do is make sure that your assistant is holding correctly. If your patient is crazy, if your patient is very anxious, if they're bouncing all over the table, obviously that's going to influence your result. So as calm as you possibly can. There is some research to support if they're laying down and you leave them laying down for a few minutes, that's going to be the best indicator of your pressure. But again, that's not always possible if we're dealing with an awake patient. So do the best that you can. But the important thing to remember is that we don't want anything that's constrictive around the neck itself. So look at collar placement. Look at the way that your assistant is holding your patient for you. If there is a lot of pressure around the neck and there's pressure along the jugular veins there, that will falsely elevate your pressure. If your patient has a lot of corneal disease, and obviously Pekingese here, this would be a breed that would potentially have a lot of corneal disease or a lot of corneal pigment, that can possibly increase your pressure as well. So if ever in doubt, reach out to me. Let's talk about it and let's see if it's something that needs to be referred or something that we need to treat right away.